individuals, assessing the kids apart from the people in the office. So we had a lot of independent assessment of what was going on. The final outcome measurement from the study was the CARS test. We did 5 weeks of sham treatment in one group, and another group got treatment all the way through that. And then at the end of 5 weeks, everybody started in treatment. Well, the people who were already getting treated continued. That gave us 3 populations: 5 weeks with no treatment, 5 weeks of treatment, and 10 weeks of treatment to assess in terms of our outcome measurements. And this is what we saw. So the orange line represents the sham group. So this is a clicking sound in a shell of a magnet, but no magnetic discharge. And you can see that's pretty much a flat line. There's a little trend towards improvement, and I believe that's because the kids are getting used to being in the office every day. They're getting assessed every day. They're kind of calming down. Some of their anxiety is going away. It's easier for them to be assessed by docs. The blue line are the kids who got treatment. So we saw a very rapid change in the average for the population. Now, there's a problem with doing population studies with individuals like autism because it's a very heterogeneous disorder, right? Now, they all start off severe. The average was 41. That's bad. That's severe autism. So we didn't take just the mild, lightweight cases. So with that, the average by the end of the first 6 weeks showed that we had a significant population, I'll show you those numbers, that had moved out of the scoring range that was diagnostic of autism. So our threshold for saying that you're a responder and a successful outcome is that you have to drop below the threshold, which is about 30, depending on your age, for criteria of autism. Now, that doesn't equate to neurotypical, but that's a whole lot better when you go from severe to not qualifying for the diagnosis. So let's look through this a little bit more. And you look at these, and when you see the group that started at 5 weeks who were the sham, the same curve. That's the same curve being replicated in that population. But this is the real outcome that we're looking for. So if you look at the number of cases by 5 weeks in the MRT group, which is, you'll see the timeline and then you'll see MRT and then sham, at 5 weeks, 6 out of 14 kids had fallen below the threshold for autism. Now, that mathematically means that the slope of that curve, if you looked at only the responders, would be like, oh my God, like within a matter of a few weeks, they're like, boom, they're down there. But not everybody responds. By the end of the 12th week, 9 out of 14 children had responded in the 10-week treatment group. So they got 10 weeks of treatment, then we looked at another 2 weeks after that to see the sustainability of the effect. That means that 5 out of 14 didn't respond by our criteria. They may have been somewhat better, but they didn't get the dramatic effect that we were looking for. So that meant that we had a 9 out of 14 with 10 weeks of treatment chance of being in the dramatic responder group. But not everybody's going to respond. We're doing some things to try and get more people into that lifeboat, into that responder boat, and we're getting better results all the time. In the sham group, basically the same thing. By the end of the 10th week, 5 out of 14 had responded, very close to the 6 out of 14 in the other group. And at the end of their period of time, 7 out of 14 had responded. So that's pretty cool. So Kevin Murphy is going to come indirectly here. So this is his comment. It's been on the web. It's been published before. Kevin is the Associate Professor and Vice Chairman of the Department of Radiation Medicine and Applied Sciences at the University of California, San Diego. He's basically a translational neuroscientist. He's trying to take research and put it into action in the neuroscience department at UCSD. So here's what he says. What the Brain Treatment Center has done is revolutionary. Using evidence-based principles with TMS, they have created a delivery system that customizes treatment based on the patient's own QEEG, addressing the core frequency mismatch, which in actuality is only part of what we do with our analogs, that occur in the various parts of the brain and not the patient's symptoms per se. It allows this system to be potentially useful in numerous psychological and neurological conditions from autism to Alzheimer's. Kevin actually has a center that's treating kids with autism. He's observed the effect in his own child who is on the spectrum, and he's open to talk about his own kid's journey with MRT, which was dramatic. And he has a very interesting longitudinal study that he's doing at this little focus center in UCSD. With a variety of conditions, primarily Alzheimer's. So you can go on my blog site, www.drbradstreet.org. There's a bunch of stuff about MRT there. And there's also some very interesting work on the other side of UCSD, which is Corshane's group, on cortical defects within the brain, where they actually are seeing structural abnormalities looking at the transcriptional message. I'm going to talk about that tomorrow in the morning lecture with more detail. Also on that blog, you can see Ashley Lamons from last year's presentation. She's the mother of twins and another who wound up in our study last year. Actually, triplets, right? Not twins. Yeah, triplets. Yeah, 2 girls and a boy. And you can listen to her talk about it. And then I want to share with you some of the follow-up a year later. So one of the big concerns that we all have is how sustainable is the effect. If you invest this time, effort, and money and resources in taking care of your kid, does it last? So we've done a 1-year follow-up, and I want to share the results of that. So 2 of 28 children had no further gain. So wherever they were a year ago, they're still at that same place now. 4 additional children progressed into the sub-threshold category. So their scores that were not below 30 moved to below 30 over time. That's delayed effect is actually really common in what we see. Now, part of the reason that we got 4 more kids in is because the 5-week group, the sham group, got 5 more weeks of treatment later on. So they actually got another 5 weeks of treatment. That put another 4 kids into the full response range. So at the end of the study, 16 of 28 had progressed from an average severe score of 41 to less than 30. By 1 year later, 20 out of 28 had progressed to below 30. Pretty dramatic. Now I have a special guest, Miss Ashley, and your mama. Bring your mama with you. So come over here for a second. So, Ashley, I'm going to ask you a couple of questions. Relax. First of all, take a big breath. You're not very used to public speaking, are you?
No, I'm not.
Okay. So how old are you?
I'm 18.
And where do you live?
Calgary, Alberta, Canada.
And what do you like to do for fun?
I do biathlon, that is cross-country skiing and shooting.
And are you competitive with that?
Yes, I am.
And what's your favorite ski resort?
The Nordic Center, Canmore.
Oh, that's a good one. I like that one. Have you been to Banff?
Yes.
Okay, do you like the city?
Yeah.
It's kind of cool. Yeah.
Yeah.
So have you skied at Sunshine?
Yes.
That's my favorite Canadian ski resort is Sunshine, for those of you who haven't been there. All right, so who's the lady beside you?
My mom.
Oh, yeah, that lady. Okay. So I'm going to let you sit down for just a second. Have a seat. I'm going to pass this over to Mom. And Mom, you can stand there, or you can use this microphone if you want. Why don't we do this? Why don't you use that microphone right there? I'll get that down.
All right.
Here. Why don't you tell your daughter's story?
Okay, well, Ashley was, she was typically developing baby, and she regressed after her MMR shot when, I call it, at 15 months. And I remember we were going to visit my in-laws, and I said, well, let's get this early and get this over with, right? And then we went there, and she had the worst diapers. She wouldn't sleep, and I thought, what is going on, right? And at that point, she picked up, oh, he's making fun of me about the Canadian A.
You got a bit of a Canadian accent there, yeah?
Yes. I remember she picked up a beaded necklace, and she wanted to carry this thing around, and I thought, oh, okay, whatever, that's kind of cute. Maybe she's going to be a girly girl. But she never put that necklace down till after MRT. It wasn't the necklace. The necklace turned into a string, and she would walk around and have strings in front of her face. She'd watch TV at home with strings, and she'd get angry at me if I said, I sit there and do the same thing. I'm trying to figure it out, right? Because I'd say, why are you doing this? She said, I don't know. I just like to. So after we did the MRT therapy, like we've done numerous things over the years. She's done 40 dives in HBOT, and she's taken numerous supplements. We've done, what's the one where you make a plane fly with your neurofeedback. And I just always believe that it's not just There's something wrong physiologically.
But you were doing a lot of things to kind of help her?
Yeah, absolutely.
So you told me one thing that blew me away, okay? So, and I mentioned it kind of briefly. So you had testing through the school system, and what was the number they gave you with your daughter?
48. And we had the testing when she was in grade 3 for an IQ. And the first time I saw that, I was devastated. I'm like, are you kidding me? And they just want to give up, right? And then when she wanted to go into junior high, we got it tested again, and I think it actually got worse, because there was a special program in Canada where they would have a 6-to-1 ratio, but it turned out she wasn't smart enough to go in that class, so they just throw her in the rest of the class and make you do whatever, right? So junior high was the worst for her. And then we tested her again just going into high school, and she's 18 now, so that was only 4 years ago, and I actually paid for that myself, because I thought, well, maybe these guys just don't want to fund it or something like that. Same result. And looked for someone who understood kids on the spectrum, and we still had the same results. So that was pretty devastating. But I mean, she actually graduated high school, and she the MRT, she's way more social now. It brought out more of a typical child, where she used to rely on me for everything. Now she's like, I'm on my own.
So, speaking of being on her own, I think I'm going to let her do some talking.
Okay, good
All right,
idea.
you did a good job, Mom. And by the way, Mom, high five. You've done an awesome job. All right, Ashley.
She's
take
done
another
all the
breath.
hard work.
Take another breath. Good. Okay, so why don't you tell us your story? Tell me what MRT felt like for you. What did you experience with it?
Well, when I first did the MRT, it felt like someone was tapping me in the head like 100 times. So it felt kind of weird, but then I got used to it, and...
Go ahead. You're good.
And then it was like not so bad, but I always felt tired afterwards. But
did you get a headache from it?
No, I did not get a headache from that.
That's good. And what happened to your self-stimulatory behavior in your string?
Well, I used to take strings like a lot, like even when I was calm. And then one day I said, one day I was like, I just didn't shake when I was completely calm, and just shook whenever I got upset about something. And then one day I said, I'm not going to try shaking any strings. And from that day on, I haven't gone near any or touched any strings.
Do you recall about how long it was into the MRT that happened?
It was about 3 or 4 weeks afterwards.
So it didn't happen during it, but it was kind of one of those delayed effects where you got back home and things calmed down.
Yeah, that's how it worked.
So were you perceptive of noise in your head? Could you tell that there was like a hard time connecting? Did you have any awareness of that?
No, not really.
Okay, so when it changed with the MRT, how did you feel about just processing information in life and the things that you see around you?
It felt really, it changed a lot. And it felt good to understand the world much better than I used to.
So you get it, what's going on around you?
Yeah, I get that now.
Okay. And you get overwhelmed?
Sometimes not.
Like when you're on stage talking to me? Maybe a little bit?
Me a little bit, yeah.
Yeah, you're doing awesome. I am so impressed. Is there anything you want to share with the moms and dads that are here?
I want to encourage you to try this therapy, because I heard a lot of other success stories from other people about this brain therapy, and it works really well, but fortunately sometimes it doesn't, but I hear a lot of good things about it. My mom has friends who have autistic children, and one of the kids used to be nonverbal, now he won't stop talking.
That is awesome. Is he a friend of yours too?
Yeah.
Sort of.
Sort of, yeah.
Okay, I got that. Anything else?
Well, there's one thing that when I studied biathlon 5 years ago, and my shooting always let me down when I raced, because I wasn't able to understand the concepts of the shooting, and my skills weren't very good. So I was a good skier and stuff, but I just wasn't able to shoot that well. And one day my coach asked me a question. He was like, why do you think you shot better at nationals? And I said, because my anxiety was gone. And that was the honest answer. I couldn't figure of anything else to answer with that.
That's incredible.